Hello, today I'm going to talk about a type of stroke that is hemorrhagic stroke, or it can be classed as also bleed. So in my previous video, I have talked about there are two types of stroke. One is the clot and one is the bleed or hemorrhage. So let's talk about hemorrhagic stroke. Now, hemorrhagic stroke tends to be a bit more serious in terms of medical outcome wise, but today I'm going to focus about actually what is the effect of hemorrhagic stroke and why you should be hopeful about it afterwards. So hemorrhagic stroke is when a blood vessel bursts. It is similar to when a main water pipe bursts, there's a flood of water, and when the artery bursts, there is a flood of blood in the part of the brain. Now what happens? Like if our skin gets a cut, we get some swelling. Exactly the same thing happens. When there is a blood artery burst, there will be a swelling in the brain, but our brain is enclosed in our skull. Yeah. So what happens? When the brain swells up, the like kind of jelly kind of liquid between the skull and the brain gets pushed, and that creates pressure on the brain. So our brain doesn't quite work well when that swelling happens. But normally what I have seen in my experience of more than 1,000 patients over the last 7-8 years is that from the date of the stroke, after 4 to 6 weeks, normally by that time the swelling starts to get less, the blood that has come out that gets absorbed, and sometimes quite often we see that patient's recovery all of a sudden changes. The patient's thinking, cognition might not be that good, or speech might not be good, but after that time we see a sudden change. So if you know somebody, or if yourself had a bleed, and if you had a new bleed and you're wondering what the things are going to be, so you might notice after 4 to 6 weeks, all of a sudden things will change slightly. I'm not saying it will all go away, all the challenges, but it will get better. So that's it. That's the main news I wanted to share with you. Thank you so much for watching.